One of the major problems with the closing of hospitals and the withdrawal of services from hospital is that it robs people of the opportunity to maximize their potential, and it robs the mother who's pregnant of an opportunity to ensure that her child has a healthy start.
Interfaith was another hospital that we had. And they shut that down. That turned into a shelter, and now they're like condominiums. So that's crazy. I don't know why you would even do that. Instead of just renovating the hospital and bringing in better staff and doctors to treat people within the Bed-Stuy, Fort Greene area or Crown Heights area. We don't have that many hospitals within this neighborhood, within the Bed-Stuy, Crown Heights neighborhood, and then the ones that we do have are not efficient.
And when these services are not there to help the woman get easy, ready, timely, quality access, she cannot be assured of a good pregnancy. Now, lack of prenatal care, late prenatal care, access to poor care, whether early or late, or worrisome access, stress about accessing care, leads to low birth weight and prematurity. Prematurity leads to babies that are born that suffer developmental delays, slow development, slow motor skills, slow learning skills. Many of these babies end up in special education.
I've heard where clients had to travel anywhere from an hour and a half to 2 hours transferring on 3 buses to get to their doctor's appointments. You shouldn't have to go just to the hospital for your services. There should be clinics throughout the community that you could go to.
When I talk about hospital closures and the loss of services, I like to coin a phrase that I've been using called administrative Katrina. And I refer to it to reference the hurricane that happened on the Gulf Coast, where there was so much neglect and lack of planning that thousands and thousands of people suffered that didn't have to suffer because government just simply turned their back on those communities.
It's definitely, to me, a city, state, and federal responsibility. I say city first because most hospitals are city and state run, mostly city. So it's I feel the responsible of all of those entities to ensure that people have good health care quality. And then again, I'm going to say this, it's politics because it gets into the demographics of neighborhoods. If you have lower socioeconomic incomes in a certain neighborhood like Central Brooklyn, then no, you're not. Those entities, the government, the city, the state, they're not going to pay much attention.
We feel that for the commission to be really effective in right-sizing the system, community-specific health needs assessment must be done. And responsible assessment, not just anything. Responsible assessment associated with community health planning that is community specific, because each community has its own culture.
Well, one solution, like I said, is to definitely keep pushing and writing to your council members, your people, whoever is in charge of keeping these hospitals open. You know, write to those people. I mean, even if we can start a local petition, and it's all about, everything is about awareness. On a national level, if we can ever get to that point where we can have free health care, where, and not just because it's free means, again, it's so important about the quality of service you get when you go to a hospital. So, okay, free healthcare and good quality. That's good quality service. You know, on a national level, like, pay attention, pay attention to the areas that are suffering.